I'm going to shut the door and ensure the patient has privacy and then wash my hands. Hi, my name is Payton. I'm going to be your student nurse today. Can I have you verify your name and date of birth for me?
Michelle Christian, January 9th, 1994.
Okay, and can you tell me where you are?
In the hospital.
And can you tell me what day of the week it is?
Tuesday.
And what year we are?
2015.
Okay, so the patient is alert and oriented ×3. Her affect is appropriate for the situation and her speech is clear. She is peering her stated age. And do you have any allergies?
No.
And are you in any pain?
No. On a scale of 0 to 10, no.
Okay. And now, first thing I'm going to do is check your scalp. And there are no signs of any masses or lesions. The face is symmetric. Can you puff up your cheeks and smile? Okay, so cranial nerves 5 and 7 appear to be intact. Now I'm going to check your eyes. Okay, so the patient is Perla. Now I'm going to check your conjunctiva, which is pink. And now I'm going to open your mouth. Or can you open your mouth and say ah? Okay, so the uvula retracts and her tonsils are 1+ bilaterally. Her oral mucosa is pink. Her teeth are all there and her tongue and gums are both pink and moist. Now I'm going to check your carotid pulses. And they are 3+ bilaterally. And now I'm going to check for brewing noises. Okay, so there are no brewing noises. And then I'm going to check your heart sounds. This is aortic, pulmonic, herbs, tricuspid, and mitral. And at the mitral, you listen for the apical rate for 60 seconds. Then I'm going to switch my stethoscope to the bell and go back up. Okay, and next thing I'm going to do is check your lung sounds. So every time I move my stethoscope, I'm going to have you take a deep breath. And now I'm going to listen to your lung noises on your back. Every time I move my stethoscope, I'm going to have you take a deep breath. Okay, so there's no adventitious noises. And now I'm going to check your upper extremities. There is no signs of edema and there's no masses or lesions. Now I'm going to check your brachial pulses, which are 2+ bilaterally, and radial pulses, which are also 2+ bilaterally. Now I'm going to check your capillary refill, which is all less than 2 seconds. I'm going to have you go like this. Okay, so the patient has no signs of clubbing. And can you squeeze my fingers for me? Okay, so the strength is equal bilaterally. Next thing I'm going to have you do is I'm going to check the temperature. So the skin is warm and dry. And now I'm going to check your lower extremities. There's no signs of any masses or lesions. Now I'm going to listen to your popliteal pulse, or feel for your popliteal pulse, which is 1+ bilaterally, tibial, which is also 1+ bilaterally, and your dorsal pedis pulse is also 1+ bilaterally. and there's no masses, lesions, or edema in the lower extremities. And now I'm going to have you lay down. And I'm going to listen to your bowel sounds. Okay, there are bowel sounds in each quadrant. Now I'm going to feel for tenderness. Is there any tenderness?
No.
Okay, and now I'm going to listen for tympanic noises. Okay, so there's a hollow noise over organs and tympanic noises over non-organs. In the right upper quadrant, there is the liver. The right lower quadrant is going to be the appendix. The left upper quadrant is going to be the spleen. And the left lower is the sigmoid colon. Now I'm going to have you sit up. Okay, so there's no signs of any JVD or jugular venous distension. Now I'm going to have you stand up. Okay, bend over and touch your toes. The spine is S-shaped and normal. And as the patient was laying down, her contour was flat and her ratio is 2:1. Anterior-posterior ratio is 2:1. And now I'm going to have you stand with your feet together, arms at your side, and eyes shut for 20 seconds. Okay, so the patient has a negative Romberg test, and now I'm going to have you walk to the end of the room and back. So the patient's gait is normal and her stride is steady. And now I'm going to have you sit, and I'm going to test your Babinski reflex. So the patient has a negative Babinski, and that concludes my assessment.